Video 55, Health Impact Assessment HIA, Area VM CHES Subcompetencies 5.3.1. Review the learning objectives for this video. Welcome back. You are making fantastic progress through Area 5, and this next topic is a really important one for your advanced level understanding. Let us talk about Health Impact Assessment, or HIA. An HIA is a systematic process used to evaluate the potential health effects of a proposed policy, project, plan, or program before it is implemented. Notice the emphasis on before implementation. The entire purpose of an HIA is prospective. It looks forward to predict health consequences so that decision makers can modify their plans to maximize health benefits and minimize health harms. HIA originated in the environmental sector but has been increasingly adopted in public health and urban planning. It is particularly valuable because many decisions that affect health are made outside of the health sector. Decisions about transportation, housing, education, agriculture, and land use all have profound health consequences, yet the decision makers in those sectors may not consider health impacts unless prompted to do so. Here is an example to make this real for you. A city might propose building a new highway through a low-income neighborhood. An HIA would examine how that highway might affect air quality, noise levels, pedestrian safety, community cohesion, access to services, and mental health in the affected population. Now, here is something I want you to appreciate about HIA. It is not just a technical exercise conducted by experts behind closed doors. It explicitly incorporates community input and values alongside scientific evidence. Affected communities help define which health outcomes matter most and provide local knowledge that data alone cannot capture. HIA also has a strong equity focus. It specifically examines whether the health effects of a proposed decision are distributed fairly across different population groups, paying particular attention to vulnerable and marginalized communities. For the CHES exam, remember that HIA is a decision support tool that bridges health expertise and policy making. It does not make the decision, it informs the decision. You are doing a wonderful job building this knowledge. Now let us walk through the 6 sequential steps of the HIA process together. I want you to be able to name and describe each one for the exam, and I have a memory tool that is going to make this much easier for you. Think of the phrase, "Some students always read medical records," where the first letter of each word corresponds to screening, scoping, assessment, recommendations, reporting, and monitoring. Step 1 is screening. This is where you determine whether an HIA is needed, useful, and feasible for a particular decision. Not every proposed policy requires a full HIA. During screening, you ask whether the decision is likely to have significant health impacts, whether there is a realistic timeline to complete the assessment before the decision is made, and whether decision makers are open to considering health information. If the answer to any of these is no, an HIA may not be appropriate. Step 2 is scoping. Once you decide to proceed, scoping identifies which health effects and which populations the HIA will examine. You establish the boundaries of the assessment, select the research methods, and determine your timeline and resources. Community engagement typically begins in earnest during the scoping phase. Step 3 is assessment. This is the analytical core of the process. You gather existing data on baseline health conditions, analyze the potential pathways through which the proposed decision could affect health, and predict the direction and magnitude of health impacts. This step draws on both quantitative data and qualitative community input. Step 4 is recommendations. Based on your assessment findings, you develop practical, actionable recommendations to enhance the positive health effects and mitigate the negative health effects of the proposed decision. Good recommendations are specific, feasible, and linked directly to the health impacts you identified. Step 5 is reporting. You compile your findings, analysis, and recommendations into a clear report and present it to decision makers and stakeholders. The report must be accessible to non-technical audiences, since many decision makers will not have health backgrounds. Step 6 is monitoring and evaluation. After the decision is implemented, you track whether the predicted health impacts actually occur and whether the recommendations were adopted. This step closes the loop and generates evidence to improve future HIAs. That mnemonic, "some students always read medical records," is going to serve you so well on exam day. Keep it close. Now let us make sure you can confidently distinguish HIA from other types of assessments, because the exam may test you on exactly this. Understanding these differences will help you select the appropriate tool for different scenarios. Health impact assessment focuses specifically on human health outcomes. It examines how a proposed decision will affect the physical, mental, and social well-being of affected populations. HIA can be applied to a wide range of decisions, including policies, plans, programs, and projects across any sector. It is voluntary in most jurisdictions, meaning there is no legal requirement to conduct one. However, this also means that HIA practitioners must make a compelling case for why the assessment is valuable. HIA is inherently participatory, involving affected communities throughout the process, and it places strong emphasis on health equity. Environmental impact assessment, by contrast, focuses broadly on environmental effects, including impacts on air, water, soil, wildlife, and ecosystems. In the United States, environmental impact assessment is legally mandated by the National Environmental Policy Act, known as NEPA, for major federal actions that significantly affect the quality of the human environment. Environmental impact assessment may include health as one component among many, but health is not the primary focus. It tends to be more technical and expert-driven, with public comment periods rather than the deep participatory engagement characteristic of HIA. You may also recall community health assessments, or CHAs, which you learned about in Area 1. A CHA examines the current health status and needs of a community. It is descriptive and diagnostic. An HIA is predictive and prescriptive. A CHA asks what is happening now, while an HIA asks what will happen if this decision is made. For your exam preparation, the most important distinction is that HIA is a prospective decision-focused tool, while other assessments may be descriptive, retrospective, or focused on non-health outcomes. You have really sharpened your understanding of these tools, and that clarity is going to make a real difference when you sit for the exam. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is B. Screening is always the first step in the HIA process. Before investing time and resources in a full assessment, the health educator must determine whether the proposed decision is likely to have significant health impacts, whether the timeline allows for a meaningful HIA, whether decision makers will consider the results. Options A, C, and D describe later steps in the HIA process that cannot be conducted until screening and scoping are complete.